Good evening, everyone. Good evening, Dr. Eric. This special session is going to be 1 week long, every 9 p.m. Manila time for Monday to Friday. And the reason we have this is because of the leadership of Dr. Eric Tayag as the chair of the ASEAN eHealth Technical Working Group and also as the lead for the Philippine National Digital Health initiatives. The logic behind the assessment is for us to review what we have submitted as assessment data to the Global Observatory for eHealth. Some of the countries submitted in 2013 and some of the countries submitted in 2015. And we thought that the review was an important step now that we are entering 2021 and we now have the global strategy for digital health and an upcoming assessment is actually in time. So a review of what we had in 2015 in preparation for an assessment for 2021. And rightfully for tonight, we have the chair of the ASEAN eHealthcare Technical Working Group to present the Philippine perspective. And then in subsequent days, we will have countries also presenting, and I think they're also members of the ASEAN eHealthcare Technical Working Group, like Dr. Thep and Dr. Fazila. So without further ado, I'll pass the floor now to Dr. Eric to present the assessment of the eHealth of the Philippines in 2015. Dr. Eric, the floor is yours.
Good evening, everyone, and to all the participants here in the Philippines and in other countries in the region. To start the review of the Global Observatory for eHealth, the survey done in 2015, I'd just like to put on the table that this is done to prepare ourselves for another meeting in the ASEAN so that we can have a second look at the survey done in 2015 and to decide with a follow-up survey. And it's been more than 5 years, especially now that we are in the pandemic, the COVID-19 pandemic. Okay, this is the the what we can share for tonight's meeting. Okay, we start with the country profile in 2015. As you can see, when you compare this to the 2013 country profile, it's just like they are carbon copies of each other. Nothing has changed much between 2013 and 2015. And this is very important because 2013, they also had a survey and then another survey in 2015. So why a survey in 2015? Okay, here we will provide you with the results of that survey in 2015. The special focus for that survey was the use of eHealth in support of universal health coverage. So the results actually are contained in the Atlas of eHealth Country Profiles. So if you can get hold of this publication, each member state will have their country profiles based on the results of the Global Observatory for eHealth survey done in 2015. Okay. There are 8 or 9, okay, important aspects of universal healthcare for which there was anticipated support from eHealth. We begin with the eHealth foundations. On this screen, for example, the foundations for eHealth includes policies, funding sources, multilingualism in eHealth, and eHealth capacity building. Okay. I'd like to give an orientation for this on this screen because it follows the same pattern for the other aspects of the survey. Okay. The country response, that's the Philippines, is shown on the second column here. Okay. This is compared to the global response. Okay. And then the year adopted, or depending on which other parameter is used, will be found on the last column. So for example, the National Universal Health Coverage Policy or Strategy, the Philippines answered yes. Okay. Now, the global yes response for this particular attribute is at 75%. So those who participated in the survey, only three-fourths had universal healthcare coverage policy or strategy. And the question whether when was this adopted for the Philippines, it was in 1998, more than 2 decades ago. So that's how you will read on this atlas when you see each of the aspects for which eHealth would be supporting the universal health care. Okay. And so for policies, it will include several attributes as shown here. So not only on the policy, okay, but it also on universal health coverage, but it will now look into the e-health policy, the health information system policy, and the telehealth policy. At that time, the Philippines said no for the telehealth policy. Remember, this was in 2015. And even globally, telehealth had a very low output, only 22%. So that was 5, 6 years ago. Now, for funding sources for eHealth, the survey wanted to find out if the funding was typically from government funds or it was being supported by private or commercial funding, or there are contributions from donors, or there's a combination of the public and private. So the responses are shown on this screen. Okay. But what is very telling here is that it's still the public funding, okay, that is the major source for eHealth. Okay. More than three-fourths of the total funding that was uh, being required for eHealth. Now, multilingualism in eHealth, it looks on the policy on multilingualism and in multiple languages. Okay. While the global response was below 50%, the country was not ready at that time for this particular aspect of multilingualism. And then we looked at the e-health capacity building. Uh, please look at the attributes. When you actually imagine what the capacity building for e-health, you'll be surprised that the attribute here was dichotomized into the pre-service training or the in-service training. So that's how the survey was constructed. And of course, the capacity building was biased for health science students as a pre-service requirement. And that is shown here in the last column for proportion. Now let's look at the second aspect for which eHealth may support universal health care, and it's the legal framework. Okay. So the Philippines answered so many no here, and we compare it to the global average, and you'd see that the items where the Philippines answered no, the global response has been less than 50%. Okay, except except for this item where we answered yes. Okay, I'm going to the bottom, allows individuals to specify which health-related data from their EHR can be shared with health professionals of their choice. We answered yes, and globally, that was not acceptable. It was only 28%. So the way you look at this table is that you compare your country's response to the global. So ordinarily in 2015, when you answer no, okay, it's less than 50% for the global. Okay. At least there's an agreement with that, except for what I have just described. Okay, if it's a yes, it should have been more than 50%, but it seems that it is a unique attribute for the Philippines at that time. Now on telehealth, okay, um, it was based on what was actually uh, the types of telemedicine that actually has shown some success for uh, getting access to it. And it only lists five. It's teleradiology, teledermatology, telepsychiatry, and remote patient monitoring. Okay, when you see this sign, okay, it means that the country who did the survey did not answer this particular item. So remote patient monitoring allows us to monitor the patient status based on remote equipment so that face-to-face consultation, which is not possible, can give us health status parameters like blood pressure, ECGs, and the like. And so this is how it was revealed in the survey. So the health system level is whether it's international. So that means there are collaborations from other countries outside the region. Uh, Intermediate would mean that it's in the subnational level. Telepathology would mean that it's in the um, primary care facilities. Now, the fourth one is on electronic health records. So there are several attributes. For example, they begin with an overview. Okay, the health facilities with EHR. So they just listed which facilities have EHR, and then other electronic systems aside from the electronic health records. So they differentiated this from other information systems. Okay, at that time. And then the ICT assisted functions, whether the purpose is for medical billing or supply chain or for human resources. Um, of course, at the time, the our response was we did not have a national EHR system in 2015, but I'd like to provide the context later after providing you with the summary of these findings. Then the fifth one is the use of e-learning in health sciences. So there's again an overview, and it lists the health science for students, the pre-service, then the in-service. So there is a juxtaposition of this fifth aspect with the another um, aspect which I have described to you earlier. So here they just enumerated the disciplines like medicine, dentistry, public health, and um, and the results show that mostly for the pre-service, more from the discipline of medicine actually have some functional um, e-learning in the health sciences. Comparing that for the professionals in service, it's still medicine, but it's not happening to many countries, even with the e-learning aspect in the health sciences. Now, from mobile health programs, okay, they actually wanted to find out if mobile health can actually support access to health services, access to health information, and for collecting health information or data. Okay. So for toll-free emergency, we didn't have an answer at that time in 2015. And then we had to say yes and exactly at which system level. So for call centers, for example, it's available at the primary care level. Reminders is subnational and nationally. Mobile telehealth, it's regional. It's not the ASEAN region, but this is subnational also. And of course, the program type. Well, so if we're just starting on certain areas, it's considered a pilot. Okay. What was established was the management of disasters and emergencies. That's the one that's reported here. Of course, you can understand this because the Philippines has been hosting different natural disasters for the past decades. And so it's understandable that we have established this. And then for health information, okay, so it's only the decision support systems for which there was no answer, and I would like to know from my colleagues here if at that time there was really no information to validate whether or not we had decision support systems using mHealth. And collecting health information, there's semblance that we collected health information for patient monitoring for health surveys. Now, social media is an important aspect because of the growing use of social media across different um, levels of the population, economic levels of the population. Okay. Somehow, the survey wanted to find out if there are policies, whether or not the healthcare organizations and their use of social media down to individuals and communities. We are not far behind from what's happening globally, and this is understandable that the Philippines is one of those countries in which social media is your daily breakfast. And the last one is on the big data. Okay. And just like globally, for most countries, big data at that time was unheard of, or it just has the beginnings. I will end my presentation with this context. So that was the Global Observatory for eHealth survey of 2015. Okay, that was summarized using the atlas. So I encourage you to get hold of that publication so that you'll be able to understand, and it will be easier for you to get the country profile using the atlas. But here's the context. In 2015, while we said that in 1998 there were policies already for universal health care, the law on universal health care in the Philippines was only enacted 4 years later. That was in 2019. Okay. Well, there was some beginnings of telemedicine or telehealth. So I'd like to know from my colleagues who participated in that survey, telemedicine actually only gained prominence during this COVID-19 pandemic. And when we look at the infrastructure and connectivity, the agency responsible for that in the Philippines is the Department of Information and Communications Technology, that's the DICT. And this was only created in 2015, the same year when this survey was actually done. Now, the electronic medical record system, okay, that we said we had, was actually leveraged with the PhilHealth reimbursements in 2017. Okay, 2 years after the survey, so that we were able to actually scale up the electronic medical record system. And the final context for all of this was in 2015 marked the transition from the Millennium Development Goals, okay, to the Sustainable Development Goals, okay, wherein good health and well-being was the Sustainable Development Goal number 3. And at that time, there was already too much talk as early as 2015 or even a decade before this that digital health, as we know eHealth now, actually will have a significant support for the universal health care or universal health coverage. And that is why the context for that survey is how eHealth can support universal health care. And these were the items, okay, that were included. And so the attributes were related to this particular focus. Thank you so much. And I hope I was able to deliver with for the purpose and intent of this meeting. Thank you so much. Yes, I can.
Yes, thank you very much. I don't think Alvin is on. Alvin is in another call.
Okay.
Dr. Alvin,
Good
that's
evening, Fazila.
how are you? It's good to hear.
Nice to see you here tonight.
Yes, yes. I'll be presenting on Wednesday, so
Oh,
I'm
good luck.
learning from you how you did it.
Bunchai, good evening. Nice to
Good
see you
evening.
here. Well,
Nice to,
I was trying my best. I volunteered to start the whole week, and I don't know if yeah, I'm open to suggestions how we can improve this, but really, Alvin, with our communication with him, told us that we have to start with this actually country profile and see how we understood this, the context for which the survey was done at that time, the purpose which I already described. Thank you, Fasila and Bunchai.
Yeah, I'm not sure if there's any other anyone would like to have questions or comments before we discuss further. Yeah, Dr. Bunchai.
yeah, congratulations, Dr. Eric Tayat, that for the you are the leader in our e-health or digital health in ASEAN, and Fasila and another Dr. Tape are going to be your kind of the team. I think we will have a strong team in ASEAN, and I think we can contribute a lot in to our regions. Uh, and I think this is a good start that you starting to to see the contract of the each for the e-health or the digital health from the atlas that WHO already done in 2015. Uh, so I just I would like to have a comment as a person who has been working on the global observatory for e-health for the the second round, and 15 is the third round. The first round I don't involve it, but the first round, as you said, it 2013, and that almost starting the same time that we as the AeHIN are established and working all around. I have experience on both, and I also would like to comment on this kind of the tools, this global tool, the eHealth of the global observatory for eHealth survey. To give you another context, global observatory for eHealth come before the WHO ITU eHealth strategy toolkit. eHealth strategy toolkit starting in 2012, but the first round of the eHealth is kind of the 2000 something, 2005 or something, and the second round is around 2010. And it's very you can see that the format of the global observatory for eHealth not match very well with WHO ITU strategy toolkits, which have allowed 7 components of the eHealth. We as a AeHIN also feedback to the WHO headquarters about this, and this is for our region, as I am had the opportunity to be observe how the WHO headquarters works. They also fragmented. The people who are do the eHealth observatory for eHealth did not collaborate very well with the group that do the WHO ITU toolkits. And they said they are trying to kind of to harmonize those, but it not harmonize very well. But anyway, the
Bunchai, I think there is some truth what you are sharing to us now, because I actually tried to look at the years that you have mentioned and the International Telecommunication Union toolkit. I came across with it, and they're not aligned. And I think you sharing with us that there really was no partnership or coordination or collaboration was very evident, because when I reviewed the documents provided by the ITU at the time, it's so it's far from what's contained in or what was asked in the survey. I think what you just shared is actually what happened at that time. Thank you for sharing.
and worse, and worse. Right now, WHO headquarters, the Department of the Digital Health and Innovation are developing another tools they call the sustainable maturation digital health something, which is they said they try to I try to harmonize or integrate all of those. And we are going, as a country, we are going to do that survey again. So that is how the international event. So don't be discouraged if we know the context. Then we look at, I think all the tools have the benefit, but the drawback is that we have to do over and over and over again. And it seems like there are so many groups similar to us that we ask the hospital and health center to send all the report over and over like again. So the behavior of the inter-hospital and inter-country and inter-country is similar. This is just to be, I mean, a base of the situation. So we as a group that work both in ASEAN and in the in our Asia region, then we will be, I mean, very conscious on this, and we can act accordingly, which will be well a benefit to our country and our region. That is just to give you the another context. I didn't say that which one is better than another one, but it burden the country to do all of these different tools, which is they should have harmonizing or at least indicate and act as less than it should be. That all. That give you, I think, for you and for our member also. I think Nico would like to raise the hand, right?
Yes. Good evening, everyone. Assalamualaikum warahmatullahi wabarakatuh. My name is Nico Azhari Hidayat. I'm from Indonesia. I'm from Universitas Airlangga, Indonesia, Surabaya. I would like to ask for to the expert about the single data that we use for the matter of health that our government, Ministry of Health, collected. What do you think about it? Is it truly now updated or necessary? Because in Indonesia, I suppose we haven't done it yet. We don't. We are not ready yet for single data. Each of the data still remains on hospitals or units, but not in the big bank data that collected by the government. Please. Thank you.
Nico, so that we can understand exactly what you're asking. When you say single data, you mean integration
Yes.
of multiple data? That's what
Yes.
you mean?
Yes.
Okay. So, and you want to find out what's the status in the Philippines, for example?
Correct. Yes, true.
Okay. In the last 5 years, there were efforts and anticipation for integrating data. And now that we have the Universal Healthcare Act, the law passed in 2019. There's a section there that actually provides guidance to all health and health-related entities to submit all health and health-related data to the Philippine Health Insurance Corporation, okay, and the Department of Health, okay. So while over the years, many entities have actually provided us with the data, now it is a law, okay, so that this was actually envisioned so that we can integrate all data, and this actually will support the portion on the big data so that we'll be able to make a sense of all of this data, because we don't only collect data that we need, we must show that we need them, and that we analyze the data and we can actually use them either on an individual level, a societal level, or even for policies that administer these programs. Did I answer your question, or?
Yeah. So the entry is the insurance, Dr. Eric.
Yeah, yes, that's
Oh,
the context. Okay,
right.
so what happened when we were actually um, establishing the electronic medical record system? The the rollout was slow. And so there was an opportunity presented itself when the field health wanted e-claims. That's the reimbursement platform of the field health, actually tied up with the electronic medical records. And so the primary care facilities, okay, at the subnational level had to actually install the electronic medical record systems. And that was how DOH and Field Health was able to leverage so that in a span of 3 to 5 years, we were able to reach over 80% in terms of the use of electronic medical records in these facilities subnationally. Okay, Nico, I hope that helps.
Thank you, Eric. Thank you.
Okay.
Dr. Eric, it's regarding this 2015 a survey. So as a ASEAN eHealth TWG, we'll be doing another one this year, I'm assuming. Yeah, but I don't think so. I think many of the questions have to be different to meet the current needs. What is your opinion on that?
Okay, Fasila, if you remembered in one of our meetings, we invited the World Health
Yeah,
Organization
yeah.
and they presented to us another
The review.
framework for
Yes,
the survey. And
yes.
this is based on a maturity
Index.
index, okay,
Yeah.
maturity level platform.
Yes.
We were having discussions with them,
Mm-hmm.
and they told us that by the end of the month,
Yeah.
they will be able to finalize the indicators or the
Mm-hmm.
survey toolkit for that actually now uses the maturity level framework.
Mm-hmm.
But of course, whether or not we're going to adopt this toolkit, that's another activity
Yeah.
for which we have in our timeline
Mm.
to discuss what they will be able to present to us. And
Right.
so I don't want to jump ahead with the decision for the member states. I'm just
Yeah.
providing you information what's
Yeah.
happening now and exactly uh, what you have just stated. The If we're going to do the survey and it's just going to use the same toolkit, it may not be relevant. It is
Yeah.
far removed from our
Yeah.
situation now, especially the pandemic,
Pandemic.
and
Yeah.
how many member states have actually introduce innovation using ICT, not only in the Philippines, but many countries in the
Yes.
region.
Correct. So
Thank you, Fasila.
yeah. Thank you.
Can I jump in?
Yes.
I think the framework that you talk is the framework that I'm just mentioned.
Oh,
That they call the sustainable maturity digital health maturity framework, something like that. And they have presenting to the digital health technical advisory group, and I have already uh, gave them the feedback of why don't they look at all the toolkits that have been in the previously, and also why don't they integrated those. The answer for them that they said they look at the previous one, but this is the new one. I have seen those frameworks, but it kind of the quite complicated to me, and I'm not quite. To me, I think the WHO ITU strategy toolkit that talking about the 7 component is easy to understand and also easy to kind of to follow up. But I think they come up with another approach. Looking, they said they will introduce the maturation model into that kind of the frameworks. To me, I think we should. I agree with you. Don't uh, quickly jump into those, but remember, this will be the WHO toolkit, which they want the all the country member to kind of adopt those. So then they will have the data to compare the country. So if we don't participate in those, it also we lose the opportunity to kind of see the big picture, the global picture. But at the same time, if uh, we look at those and it's not get well with our context, then we will have to do kind of just to
Uh,
collect data for
okay.
them.
Bunchai, that will be the agenda for our meeting. Okay, when we meet in June. But suffice it to say, what we're having the whole week, as Alvin has invited all of us, is to recall, okay, what our country's profile as 5 years ago, that was in 2015, and review the survey done in 2015 so that when we look at whatever they are recommending, we would have uh, formulated some framework in our minds and something that we can agree on at the end of this week so that when we actually meet in June, we will have prepared uh, many of our colleagues for the substantial discussions. I recommended this because, Bunchai, it's good that you have become an institution wherein you have the institutional memory of what happened many years ago. But now I was not even at the Knowledge Management Information Technology Service when I only 3 years in the leading the office, and so I'm just beginning to unravel what uh, what happened in that survey, and so with your knowledge and experience, with what I know, what Vasila will be able to share this week, maybe we can synthesize all of this so that we are prepared when we meet to discuss in June. How about that?
I think that's good. At least we still have time to feedback them about their new toolkits or frameworks. So I think they are
Thank you,
going to
Bunchai.
mhm, they are going
Thank
to
you,
talk.
Bunchai.
Mhm.
Yeah. That's why you are very, very important. Okay. Can I say you are the oldest? Now I made you smile. Okay, okay. You're the eldest. Okay.
There's one question here, Dr. Eric from
Yes,
Anis.
Priscilla.
There's a question by Anis Fuad. Is there any additional component for e-health assessment for ASEAN needs for vision?
Okay. This is how you look at the survey done in 2015. Okay. They listed this as how eHealth can actually support or contribute to achieving universal health coverage. So one thing I that was mentioned was about the pre-service and in-service training. Now, if you look closely, the trainings focus on the medical or non-medical field. Okay, it did not actually touch on the ICT, the human resources for ICT. because eHealth is not only about doctors, nurses, midwives. It should include uh, the ICT for the human resources for ICT, and they're missing in the picture. That's what I'm trying to say. Okay. And we can add more if we continue to review what was the results of that survey and look at the context on what's happening now. Thank you for that question.
All right. And so is there any other questions? Any more comments?
Maybe we can hear from our friends from the Philippines. Is there
Yeah.
someone who want to share their comments or questions? You can type in your questions if you have, or you can use your
Yeah.
microphone since everyone's mics are enabled.
Maybe we can listen for some insights from Jovi, who's with PhilHealth, so that Jovi, are you still in the call?
Yes, Doc, I'm still here.
Okay, what can you remember at that time?
Um, I think not so much, Doc, because I was transferred to PhilHealth on June 2015. But the presentation that you made, I agree with you because the eHealth strategic framework just happened in 2013-14. So the context, actually, I also agree with the context, especially in the medical record. DOH and PhilHealth are really one in one acts like one organization trying to really establish the electronic medical record. Now, with the toolkit, Bunchai and me are members of the DH tag. But my comment also there, the toolkit, the new toolkit on the maturity model will be more on assessing in terms of the global digital strategy. So there should be some review of that also. So well done, Doc Eric. So you have done a very good presentation. So we really had a lot of works done in 2015 as well as now in the universal health coverage and because of the passage of the Republic Act. Over, Dr. Eric.
Thank you, Jovi. So another context, Jovi, which was one of our principal personnel at the Knowledge Management Information Technology, uh, at that time, moved to field health. Okay, so that there will be a diffusion of knowledge and experience. That's why she moved to field health at that time when all this was happening. Okay, okay. As if all the planets are getting aligned, Fasila and Bunchai.
Okay. Any more? Any other questions or comments?
Hi,
Is
Dr.
Alvin?
Tan.
Yes. Yes.
Dr.
Okay.
Yes, Rosemary here from DOH eHealth PMO. We have received an anonymous question. It says, how can new standards be added to the Joint Administrative Order on Mandatory Data Standards?
Is that question directed to me?
None named, but this is a local policy in the Philippines that we just recently passed or signed, Doc Eric.
Can you repeat the question?
It says, how can new standards be added to the Joint Administrative Order on Mandatory Data Standards?
Or easy, because all policy on standards are what you call living guidelines. So that means as soon as new technology, innovation, and experience, new standards can be added. So that's the unique feature of living guidelines, and I think that has been these living guidelines have been adopted during this pandemic, especially when there is a faster evolution of changes that continue to occur. Okay. Thank you for
Thank
that
you.
question.
Thank you, Dr. Taig. And we're also seeing a raise of hand from Mr. John Ulysses Gallo. Over to you, Sir Yuli.
Okay. Thank you. My permission to speak po, regarding the question on how standards get to be added in the registry or the terminology service or the National Health Data Dictionary. So, yes, that's a recently signed policy in the Philippines, and in that policy, we have an implementing protocol on how standards get to be added or monitored and at the same time updated. So we follow an input process output approach, and to operationalize that, we are implementing this what we call citizens charter. So for any action request for new health data standards or update to existing standards in the National Health Data Dictionary or the Terminology Service of the Philippines, there's a team which is the National eHealth Program Management Office that consolidates and does the initial review. And once the initial review has been completed, it will be elevated to the Interagency National Health Data Standards Sub-Working Group, and to be finally vetted by the National eHealth Technical Working Group and by the National eHealth Steering Committee. So if you will look at that governance framework, we are certainly aligned or following the WHO Digital Health strategy toolkit, where it requires that there should be a robust governance structure with a steering committee at the governance level, and as advised by an interagency technical working group for the management of all the activities of the program, and to be supported by cross-agency multi-sectoral sub-working groups. Over.
Okay, thank you, Yuli. Fasila, those are the details of what I just described as living guidelines. So the living guidelines is the what, okay, for actually how you are going to add standards to what has been published or shared. And what Yuli has just shared is how you're going to go about it. Okay. Thank you, Yuli and Rosemary.
Chow, back to you, Chow.
Thank you, everyone. Are there more questions from our participants, maybe outside the Philippines or outside the Asian region? If you have comments. I guess there are no more questions, and we have 4 minutes left in the session. So again, we would like to thank Dr. Eric for that brilliant discussion. And we also have our upcoming speakers for the rest of the week here on the call. So we hope to see you again in the succeeding days. And before we end, maybe we can hear a few words from Dr. Eric and Dr. Bunsai.
Okay, thank you for all those who have participated or attended these initial discussions on the results of the Global Observatory for eHealth survey done in 2015. We have to review this so that when we meet in June, we have the full context and the insights of all member states on how they regard this toolkit, and how we can move forward because of our greater understanding of this toolkit, and a clear view of what's happening now in this pandemic, and our collective effort to make sure that in the region we're going to achieve universal health coverage. Thank you so much.
Okay, I think I will say a few words before we end this meeting. Congratulations for Philippine teams. It seems like you are now already interoperable, people interoperable between several stakeholders. This is what we really need. And, you know, we are more stronger than before. because of Dr. Erik Tayak are now working the head of the digital health in ASEAN community, and we can synergize and work together to be to help each country to be strong on the digital health. I am very optimistic to what are going to do. So ASEAN always NATO, no action for only. But I think under Dr. Erik Tayak, you will be not just talking, but we will act, and we will act very well in the next year to come. Thank you, and thank you everyone. And I think we will meet every night this week, and we can share and then also discuss about the digital health and e-health in our regions and in Southeast in ASEAN. Okay, good night. Bye.
Bye bye.
Good night,
Thank you,
everyone.
everyone. Bye.
Bye.
Bye bye. Bye bye.